Hello, humans. This is Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. One of the many policies and procedures that we have to have in place at our healthcare organizations is an employee sanction policy. We're required to document how we apply discipline and sanctions consistently to employees who may violate the HIPAA rules. A sanction policy is really important to protect our healthcare organization in the event that one of our employees violates the HIPAA rules. There was a case some years ago where a physician sat for an interview with a local television news reporter and disclosed all kinds of protected health information about one of his patients. And he did this even after his employer's privacy officer told him not to talk to the reporter. So it was quite a surprise when the Office of Civil Rights imposed a $125,000 fine, not on the physician who gave the interview, but on his employer. HIPAA does provide for employee liability, but in this case, they held the employer responsible because they found that the employer never held the employee responsible. The employer didn't have an employee sanction policy. No discipline was ever imposed on that employee. Essentially, the Office of Civil Rights found that there were no consequences for HIPAA violations at this organization. And so the OCR held the employer responsible for that employee's actions. You've got to make sure that you've got a good sanction policy to protect your healthcare organization from these sorts of violations by employees. And make sure that it's written in a flexible manner that can be applied to a lot of different situations. I was recently involved in an investigation where an employee caused quite a lot of harm and quite a lot of drama by gossiping about one of the healthcare organization's patients. Now, unfortunately, although they had a sanction policy at this healthcare organization, it didn't really have any teeth unless the employee acted out of malice. But we all know that careless gossip doesn't need to be malicious to be extremely damaging to our patients and to our organization. Your employee sanction policy, it's one of the policies that we review when we conduct the legally required HIPAA risk assessment. So if you need help with your risk assessment, your risk management program, or with responding to a recent security incident, I hope you'll reach out to us here at HIPAA for Humans. I'm Michael Herrick. Thanks for watching.